Oh, okay. All right. Good morning, everybody. I'm going to officially call the meeting of the Long-Term Care Planning Committee to order. I have started the recording, and I ask that to ensure a clean recording, everybody stay muted unless speaking. And when you do unmute to speak, if you could say your name, that would be really helpful for the purposes of minutes. I'm going to begin quickly just by doing a roll call. Christine Weston. Here. William Seals. Margie Gerando Marquette. Here. Krista Oshachevsky. Here. Erin Levitt Smith. I think I see her. Okay. Barbara Cass.
Barbara Cass is here.
Morning. Commissioner Porter.
I'm here.
Jessica Rival.
I'm here.
Lisa Rivers. Michael Santoro.
Here.
And Laura Watson.
Here.
Oh, good morning, Laura.
Good morning. Thank you for having me.
You could join. So thanks, everybody. You should have all received the minutes from the March 11th meeting. They were circulated prior. Before we dig into the meat of the agenda, I do want to entertain a motion to adopt the March 11th, 2025 meeting minutes. Do I have a motion?
Barbara Cass motion to approve.
Thanks, Barbara. Second.
Second, Mike Santoro.
Thank you, Michael. All right. Any discussion? No edits, revisions. Excellent. All in favor, say aye.
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 Hey, any opposed? And any abstentions? Okay, minutes passed. Thank you, everyone. And with that, we have a really busy and what I hope ends up being a productive and exciting meeting today. As we do every June, we have an end of session wrap up where we provide some highlights of long-term services and supports legislation that was passed that speaks directly to some of the recommendations in our long-term care plan. And Heather Ferguson Hall from OPM has joined us today to provide that update. Once we get through that, we are then going to move on to where we will be spending the bulk of our time, which is going to be really taking a step back and looking at what is the charge of this group. We've been meeting for so long, I think it's very easy to just get in a pattern of doing the same thing and reporting out and bringing information back. And as much as all of that is helpful, I think it's time we're all very busy. And I know when I'm giving up time to be part of a committee, I want it to be something that I feel like is worthwhile and actually making a difference. And so I want to just take a moment now that we're hitting end of session, that we're at a point where we need to refresh and revamp our entire long-term care plan for 2028, to take a step back. We've come really far since this group formed in 1998, right? The state of long-term services and supports, thank goodness, is not what it was then. So just going to take a moment after we do our legislative update to revisit our statute, remind ourselves of what we are legislatively charged to do. And then I'm going to propose to the group a couple options for moving forward to get us back on track towards working together to make meaningful change in the state's long-term services and support system. So very busy agenda for today. But Heather was kind enough to assist in tracking legislation this session. And so I'm going to turn it over to her. As you all know, session just ended midnight on Wednesday. So poor Heather has not had even a week to put together the written long-term services and supports plan. So I'm hoping you'll bear with us. The way we're going to proceed today is that we are going to go over just some, not every bill pertaining to long-term services and supports, but just some of the top ones that we want to make sure are on your radar. Heather's going to give a quick verbal rundown of those bills. We will, of course, as always, at any time when Heather's discussing a bill or finishes some of these pieces of legislation affect your agencies directly, and you probably have better knowledge of it. So feel free to jump in and add anything that Heather or I may leave out. And then to give Heather a little bit of breathing room to finish that more detailed written legislative report that we usually do, we will be putting together the full written report that has the whole list and description of long-term services and supports bills within the week. And that document will be circulated with the minutes from today's meeting. I just thought it would be nice to give poor Heather more than 5 business days to whip that up. So with that, Heather, I will screen share for you and turn it over to you.
Thank you, Melissa. And it's nice to see everybody. And it's good that we had this moment to sort of breathe and reflect on what's happened in the long-term services and support space over the last session. As Melissa said, we're just highlighting a handful of the bills that affect long-term services and supports. And please, as I said, jump in with questions, comments. And if there are questions that I don't have the answer for, of course, I'll get back to you. So the first one is PA 2516. Which was House Bill 6771. And this is an aging omnibus bill, and the title kind of says it all. There's some more detail, but basically the Alzheimer's Disease and Dementia Task Force. There's also a residential care home working group requiring health insurance coverage for biomarker testing. And then also looking at transfer and discharge procedures in residential care homes and tuition waivers for nursing home residents who take courses at community colleges, and looking at closures and evacuations and of RCHs and nursing homes, and trying to ensure that the factors of closeness to support networks are considered there. So, oh yeah, and I forgot to mention, I don't think it says it in the, does it say it in the title? Yes, the background checks for all employees in long-term care facilities. So that's the quick overview of that one. Anything anybody wants to add, please jump on in. The next one we're going to talk about is PA 2542, which is the Katie Beckett Working Group recommendations. Originally, this bill was drafted to eliminate the waiting list, which has about 331 people on it. But the bill was amended to now be a 5-year plan to eliminate the waiting list, and then to report back to APROPS and Human Services by October 1, 2026 about what the appropriations that would be needed to do so. And then also the bill lowers the maximum age for Katie Beckett participants from 21 to 18, because at 18, folks are eligible for Husky coverage at that point on their own. And then it also requires DSS to post certain program information on its website and to administer a survey about the waiting list so that applicants can respond about their status and if they wish to remain on the waiting list or not. And that's obviously that's close to you, Christine. Do you have anything you wanted to add?
Hi, Heather. Thank you. Yeah, I do. Just a little caveat. By lowering the age, we will be able to add more individuals onto the program, because that will free up what we call slots. So we'll be doing when we have to do a waiver amendment to adjust the age and some of the other considerations in the waiver. It will, by virtue of that age limit allows us to offer more spots off the wait list. So that's going to be great. So we're going to see a shift and an increase of people that have been waiting for quite some time. The Katie Beckett waiver wait list is about 5 years currently. And we'll be able to put a large number of people on once we go through the amendment process and the impact on the budget for those slots and those unique users. So we're very excited that it was not necessarily an unintended consequence, but a very fortunate consequence of that age allows us to put more individuals on. Katie Beckett's a great opportunity for, the kiddos whose parents aren't otherwise eligible for Medicaid, and allows the kids to have access to Medicaid as their own kind of AU, their own group. And really provides that gap for people whose private insurance doesn't meet all of the needs of in-home supports and home care that Medicaid offers. So we're very excited for that legislation. It was very well supported in the department and with their great, their advocacy groups and Rep. Gilchrist and Senator Lesser.
Thank you, Christine. That's really helpful context, and always great to hear when we can move more people off the waiting list. Fantastic. So I'm going to move on to the next bill, which is House Bill 6438. You'll notice that we update this list as we go along as the governor signs bills. So these ones are just bills that have passed in concurrence and that they have not been assigned a PA number as of last night. There might be new ones this morning, but the report will have that. All right, so 6438 is an act concerning Veterans Affairs. And once again, the title is fairly, oh, did I skip one? Oh yeah, I'm on the right one, sorry. The title just is, it's like I all of a sudden saw the State Interpreting Standards Board. So I'm looking at two documents at the same time. So anyway, basically this bill allows certain veterans benefits to be disregarded when determining income for certain means tested public assistance programs, including Husky, Medicare Savings Program, LIHEAP, State Supplement, TFA, SAGA, and CHCPE. So that is once again, good thing. And DSS may apply to CMS to amend the state Medicaid plan or seek a waiver if necessary to exempt these veterans benefits. Did anyone want to add any comments to that bill? Okay, now moving on to number 4. This is House Bill 6932, which is the establishment of the State Interpreting Standards Board. And this, as I said, the title says that it establishes it and the board will be setting education, training, certification requirements for interpreters for people who are deaf, blind, hard of hearing. And the board's duties also include establishing the training needed, and they now have a role in investigating complaints about interpreters who are not complying with the standards. The advisory board must refer complaints to Disability Rights Connecticut, but as I said, the bill now has a role in that. Commissioner Porter, did you want to add anything to that?
Yeah, I think this is great because we have very limited, our pool of interpreters in the state is very limited. So it's going to allow some performance-based entrance into that pool. The other cool thing about it is we, as most of you know, we have a new director for our new Bureau of Services for persons who are deaf, blind, and hard of hearing, and their position was funded by ARPA. So this actually fully funds their position and adds an administrative assistant position. So we're pretty excited about that because we don't know how we would do the work otherwise. So that's all, and happy to answer any questions from folks.
Thank you, Commissioner. Any questions before we move on to the next slide? Okay, next is House Bill 7108. That's something that our division has been working very closely on, both Tara Vines, who does coordination for autism services, and my role in coordinating IDD services. This is a bill that is very close to our work. So just want to report that this bill is going to have report on abuse and neglect reports that DDS will be submitting. And then there more reporting on the use of funds appropriated for its programs, and then establishing a working group to study recommendations on Southbury Training School. And then the bill also requires DSS to apply for any funds to conduct a statewide autism needs assessment. And OPM is going to be establishing a working group on the feasibility of an interagency complex case team for young adults with IDD and or autism spectrum disorder and or mental health diagnoses. And so there's a complex case team that was started in Massachusetts recently. So that's something that we will be looking at and considering other models that might work for Connecticut. And then lastly, APROPE's Human Services and Public Health it's a permissive language it allows joint informational hearing to review DDS and DSS efforts to ensure safety and quality of care for people with disabilities receiving Medicaid services. So, so that's 7108. Krista, Christine, do either of you have anything you wanted to add on that one?
Just quickly, hi everyone, Krista Ostaszewski from DDS. Heather, your summary was perfect. There's a lot in this bill, so appreciate sort of your high-level overview. I did just want to say thank you to you and to Tara, who both really helped sort of negotiate all of the components of this bill. It spanned a lot of different support services structures within DDS and DSS, but both of you were instrumental in working with human services to get this bill to a place that is workable for everyone. So just wanted to say thank you for all your work on that one. That's it for me.
Thank you, Krista. Christine, did you want to add anything?
I concur with Krista. Thank you.
Well, thank you both.
It was a monumental bill. You guys did a great job. A lot of iterations, a lot of last minute changes. But I certainly think it's something to work with and a lot of work ahead for everybody.
Yes. But once again, Tara and I are very appreciative to you both and to everybody that we've collaborated with on this and will continue to work with. So good things ahead. Moving on to the budget. The budget and the implementer were combined in one bill this year, 7287, and you probably know it's a almost 700-page bill. Many sections, quite a few relating to LTSS, but the ones I'm going to highlight today are number one, the Community Ombudsman Program, and I know Dan is on the call as Mairead, and so you may want to add some more texture to this, but basically that this will expand the scope of the Community Ombudsman Program and extending the Ombudsman's authority to look into a broader range of services, and that it will it's the broader definition of applying to home and community-based long-term services and support, which includes DSS community-based programs and providers of home care to people with disabilities living in the setting of a person's choice. So Dan, Mairead, do either of you want to add any more detail to this one?
I just want to, it doesn't expand. It just is that it was a redefining. So in the old bill, there was what was used in the definitions did not match what was in the bill. And so this was just using the language that describes long-term services and supports. So it shouldn't be an expansion. It's the same individuals, only individuals who are receiving long-term services and supports in the community, and that it'll be what we're able to do within appropriations, which right now is just info and consultation over the phone for individuals on waiver services. So just wanted to let you know that.
Thank you. Yeah, the language is extending, so I'm sorry if I mischaracterized that at all, but a good thing to have it in alignment with what's actually happening. So any other comments or questions on Section 180? All right, moving down to 181. This is DSS quality reimbursement for nursing homes. As you all know, that the movement to acuity-based rates has been ongoing for years, but this will include now a quality metrics program to incentivize nursing homes to provide high quality care to Medicaid residents. And there's two things that it will consider. One is achieving high quality outcomes based on nursing homes' performances, and two, incentivizing providing high quality services to Medicaid residents, and that they use the metrics from CMS and also state administered consumer satisfaction measures. Any additional comments, questions? Okay, and then the last one I'm going to highlight from the budget bill is home health and hospice. And this just is making changes to the laws on home health and hospice and regarding agency staff safety. requiring healthcare providers to give agencies certain information when referring a patient, extending to hospice agencies certain requirements that already apply to home health agencies, and 3, requiring these agencies to create a system for staff to report violent incidents or threats. Any additional questions, comments? Okay, and then the last one we're going to talk about today is another bill that I was working on closely, HB 7166. This is actually from DECD, and some of you are probably aware of the study that we completed last year around increasing opportunities for people with intellectual and developmental disabilities to gain employment. And so one of the things that we were looking at is one of the provisions from PA 23137 was creating this workforce incentive grant program. And at that point, it was actually, it was created as a workforce development program. It was limited just to nonprofits, and you could businesses could only get the tax break if they had at least 10% of their workforce having IDD. So it wasn't really workable as it was. So this, I'm really excited this passed because what it's going to do, it's going to lower the threshold to at least 5% of the people who are employed have IDD, that they've been employed for at least 6 months. They're paid at least minimum wage, and that this is a way to develop more jobs with that are in part of competitive integrated employment. So it's something, as I said, that I'm excited. Oh, and I don't think I said this part, that it's not just nonprofits, it's all employers. So hopefully we'll see businesses taking advantage of this and getting more folks with IDD employed. And yeah, so looking forward to see where this one goes. Any questions or comments on this one? Right. Well, as Melissa said, we will be finalizing the written report and sending it out with the minutes. In the interim, if you have any questions or comments, please feel free to email me or Melissa. And I may refer you to somebody else within this group because obviously there's so much expertise here, and I really appreciate that so many of you jumped in to share more detail about these bills because it makes it that much more informative for everybody attending. So thanks again, and over to you, Melissa.
Thanks so much, Heather. And what we will do is the slides that have the links to all these bills will be posted immediately after this meeting so that if any of the bills are of interest to you, you can just go right in and click on the links. The more comprehensive that has several more bills than what we went over today, that write-up will go out with the minutes, as we said. I also did just want to flag for the group a couple things that did not pass this session that we had brought to your attention at our last meeting. So the first is, as you may be aware, I had mentioned at our March meeting that SB 1416 was a bill that would have added reporting requirements onto DSS, but important to this group, there was also a section that added additional rebalancing study and reporting requirements onto the Long-Term Care Planning Committee. And that bill petered out, which is a good thing because really it was duplicative to what already exists in our statute and what our group statutory charge is. So that was, I think, a positive outcome that we were able to have legislators understand that. And then there were several bills this session, I believe 5, that were raised out of varying committees to address the matter of the exorbitant rate increases in long-term care insurance policies. And although none of the 5 bills got through, some of which is a good thing because some of the bills had some things that were mildly problematic. But there was also a lot of good work that went into crafting some of the long-term care insurance bills this session to help provide some rate relief to policyholders. And even though they didn't pass, we're hoping that perhaps there'll be a chance to revisit that next year in the next session. And another outcome I wanted to let everybody know of, if you were following all the varying iterations of the state budget, some good news for consumers who are on the Connecticut Home Care Program for Elders. The copay was retained at 3%, and some proposed increases did not pass. So that is just a couple of the highlights of things that didn't get through this session that we had discussed at our March meeting. So I wanted to just bring you up to date on where we landed with that. Before we move into the meat of our meeting, does anyone have anything else they want to share related to legislation that you feel should be highlighted for the group, or anything that came out of session? No? Okay then. Heather, thank you so much for the excellent update as always. And we will circle that as soon as the final written document is completed. All right. So with that, I'm going to move us into our next agenda item, which is going to be a review of the Long-Term Care Planning Committee's statutory charge and discussion of how this group would like to move forward in what I hope can be a really meaningful and proactive way to reshape the state's system of long-term services and supports. So let's see. All right. So our statutory authority rests in 17B-337. So what is our purpose? The purpose of this group is to exchange information on long-term care issues. We've been doing that great, but here's the next. It's also coordinating policy development and establishing a long-term care plan for all persons in need of long-term care. So we're not just supposed to be exchanging information, but we're supposed to be using that exchange of information to coordinate our policy development efforts and to use the long-term care plan as a catalyst for that. So when we get into talking, the statute gets more detailed into what does long-term services and supports policy development coordination really look like, and how does that intersect with the long-term care plan. The committee is charged with developing policy, and such policy and plan, so the policy our state agencies develop or that this group comes up with, and our long-term care plan shall provide that individuals with long-term care needs have the option to choose and receive long-term services and supports in the least restrictive and appropriate setting. And such plan shall integrate the three components of a long-term care system, including home and community-based services, supportive housing arrangements, and nursing facilities. So really looking at the broad swath of long-term services and supports. The long-term care plan that this group develops every 3 years also has to include certain components. And as we have decided that we are going to embark on doing an overhaul and refresh of the plan, I think it's important to really have a clear picture of what this plan is supposed to include and achieve. So the plan is supposed to include a clear vision and mission statement for a long-term care system. So the mission and vision that we've been using so far is where we came up with those two goals of the rebalancing goal of having 75% of individuals reside in the community versus an institution, and then having rebalancing the financing of the long-term services and support system to rely more on private funds. and to ensure that more of our Medicaid spending is on home and community-based services. So years ago, I think now back in 2007, those two goals were put up as what the mission and vision was going to be for the state. And that's what this group has decided in our last meeting, several meetings, that we're going to revisit and refresh. Our plan must also include just some basic data. So we have to include the current number of persons receiving services, the current number of persons receiving long-term care supports and services in the community, and the number receiving supports in an institutional setting. We have to include demographic data concerning individuals receiving supports by service type. So if you all remember, you get that big Appendix G that has to be filled out every time we do this plan, where we ask you to go through, update all the long-term services and supports programs that you run, and tell us the demographic breakdown, the number of people served, and then the demographic breakdown for that population. That's why. It's to meet this goal. This part of our statutory charge. We then have to talk about the current aggregate cost of such system of services. Again, gets back to, we have another table in the appendices of our long-term services and supports plan that you guys all help fill out, that puts down the cost of providing each of the programs that we list in that big table. And then a large section 4 of our long-term services and support plan is forecasts of future demand for services. And this is where historically it's fallen on OPM staff who go out and look at census and other data. And Heather was extremely instrumental in the current plan that we just released January 2025 of pulling the census data, finding national resources, going into the CMS database, and being able to come up with forecasts for future demand for services. And then we have to report on the type of services available and the amount of funds necessary to meet the demand. So this is where we try and project the growing cost of services over a period of time and build off of some of the work that our sister agencies do in terms of trying to plan out and forecast long-term services and supports to decide, okay, if we have this many people receiving services now and we expect X% of anticipated growth, what would the cost of those services be in the future? And then try to identify what are the resources that would be necessary to accomplish the goals for the future. So what is it that we need? And this is where we start to get into our recommendations, identify funding sources available, and then the number and types of providers needed to deliver the services. So the plan shall address how changes in one component of the long-term care system may then impact components of other parts of the system. And again, we've been focused really for the last decade of looking at how the shift to long-term services, to home and community-based services versus institutional, moves the needle and shifts resources. So this is something to keep in mind as we refresh our goals. We still probably are always going to want to keep an eye to rebalancing because you will see we have an annual report that is not going away that requires us to do that. But also, what other parts of the long-term services and support system do we need to address? For example, we have all said over and over, we don't have enough housing for people we're transitioning out or trying to keep in the community. So how can we address that? Any questions on the plan and plan components or charge of the group before I move on? So some additional requirements that this group has, and they're all within available appropriations, is in section B of 17B-337. The Planning Committee shall, within available appropriations, study issues relative to long-term care, including but not limited to the case mix system of Medicaid reimbursement, community-based service options. So what are these service options available? Access to long-term care. So what is our access to long-term care services and to geriatric psychiatric services, which I have to tell you, I forgot that one was there. So this was a good exercise for me too. And then the committee is charged with evaluating issues relative to long-term care in light of the Olmsted decision. And that is where our rebalancing comes in, requiring states to place persons with disabilities in community settings rather than institutions, if the placement is appropriate and what the individual wants, right? So making sure that we have options for persons to be in the least restrictive setting of their choice. Now, I will say when the group first formed, I believe there was like a big study that was done in the late 90s or early 2000s that looked at the Olmsted decision, that looked at access issues and all of that. But other than touching upon some of these things in our long-term care plan, there's opportunity here to really use this as a guidepost of things the group might wish to study and incorporate in the next iteration of the plan. The committee, also within available appropriations, is charged with evaluating available data on the average net actual Medicaid expenditures for nursing homes in comparison to the average net actual Medicaid expenditures for home and community-based service waiver participants who require nursing home level of care, including the number of individuals served to assist in short and long-term Medicaid expenditure forecasting. So really taking a look at what is the Medicaid expenditure difference between individuals who are at the same level of care, but one is receiving home and community-based services and one population is receiving care in an institution. Although this says within available appropriations, because this is new as of, I don't know, maybe 5 years ago now, this was something that the OPM felt that the group could do within available appropriations based on data that we already collect. And so reporting on this actually can be found on pages 3 and 4 of the annual report that this group submits to the legislature by January 1st of every year. And we give a breakdown of estimated costs. There are shortfallings because we don't know so much about the private pay folks, unfortunately, or state-funded individuals receiving home and community-based services. But we are able to report a good estimate. And then who's supposed to do all this work? So that's us. That's all of you. So the planning committee is statutorily required to include the chairpersons and ranking members of the public health, aging, and human services committees. The designee of the commissioner of the Department of Social Services, a designee appointed by the Secretary of OPM, a member from the appointed by the Commissioner of Public Health, a member appointed by the Commissioner of Housing, member appointed by the Commissioner of Developmental Services, one from the Commissioner of Department of Mental Health and Addiction Services, Department of Transportation, DCF, and then one member from the Health Systems Planning Unit of the Office of Health Strategy as appointed by the Commissioner of the Office of Health Strategy. And then, of course, one member from the Department of Aging and Disability Services appointed by the commissioner. And what we have done is the group has expanded because because the ADS also contains the State Unit on Aging. We also have always welcomed an official seat at the table to the head of the State Unit on Aging, and Marky fills that role. So that is strictly because the State Unit on Aging has also had the history, shall we say, of being located in different places. So we're just like, Marky, as long as you always stay with us, we know we're good, because they've gone from DSS to being their own entity to, being back in ADS. So we're hoping you're now in your home, the State Unit on Aging, but happy to always extend that membership.
I appreciate that, Melissa. Thank you.
Yeah, you're welcome. And then we are also told when we have to meet. So the group actually has no required meeting cadence. It's just we agreed to meet quarterly. The only thing that was ever in statute was that we had to pull together and hold the first meeting within 90 days of the formation of the statutory date to form the group in 1998. And then the statute goes on to clarify that if there's ever a resignation, that the appointing authority must swiftly make a reappointment to fill that vacancy. But this group has no set meeting cadence. So it has outcomes that we have to meet, but it doesn't have a timetable for how often we have to meet in order to achieve those outcomes. So historically, the group has decided to meet quarterly, but it's something, and I think that has worked for this group, but it's something we can certainly discuss and revisit if others have different feelings. So what are our deliverables that we have to do? So the beginning in 2018 and annually thereafter, the Long-Term Care Planning Committee shall submit a report to the General Assembly and this is the one that's related to, gets back to that other one that's within available appropriations about doing a report out on the cost between individuals served in institutions versus in nursing homes. And it also requires us to, under this, and this report's been around more than since 2018, but it was refreshed in 2018, was that we also have to do an annual, by January 1st of every year, rebalancing update. So that's that report you get. It's 4 pages long. The first 2 pages have been around forever and ever. And those are the ones that have the chart that shows historically the percentage of individuals being served in the Medicaid recipients being served in an institution versus in the community. And then the second page of that report has the big table that shows, I think going back to 2012, the number of the amount of Medicaid expenditures that goes towards long-term services and supports in the community versus an institution. And then we have tracked the change in those percentages over time. So each heading, we are able to say, from last year to this year, here's the percent change in number being served in the community versus an institution, and here's the number of the amount of change in expenditures that follows suit. And since the beginning of tracking, here's what the overall change shift in number of individuals in the community versus an institution and Medicaid expenditures is. And as you know, as of our last reporting, we were at 70-30, 70%, I believe, maybe it's 69. I think we're back up to 70% of individuals are being served in the community. And then we also have, since 1999, had the requirement to do the 3-year long-term care plan. And the previous section of the statute that we already went over details what must be included in that long-term care plan. And the big part of that we try to track so that this isn't a document that sits on a shelf is putting in the recommendations. The purpose of this document is really to every 3 years for the state agencies to come together, reset, say, okay, here's where we are now. Here's what the population of individuals receiving long-term services and supports looks like now. Here's what it's predicted to look like into the future. And here are the services we're currently offering, the cost of those services, and then recommendations for what does the state want to do to move forward to continue to improve our system of long-term services and supports. And as you all know, in the development of this plan, it is incredibly important that not just everyone sitting at this table in state government has a say in what the recommendations of our long-term care plan are, but that we also bring in the viewpoints, recommendations, needs, wants, desires of the community providers who are actually providing our services, the nursing facility industry who are providing a very important level of care, and also the advocates and individuals who are using our long-term services and support system and have the imperative lived experience to tell us, you know, despite our best planning, here's where we're still falling short. Here are ways that the state can improve. And finally, the last part of our statute is that it requires the state to make a commitment to self-direction. So we are charged with, wherever possible, keeping a focus on self-direction to the extent feasible, that support caregiving provided by family members and other informal caregivers, and support consumer-directed care. So making sure that we're providing person-centered care, that we're supporting caregivers and that informal caregivers and family members taking their needs into account and promoting consumer direction and autonomy. So how does this group go about getting the voice of the advocates, the consumers, the family caregivers? We work with our sister committee. I know this is a horrific slide, but there's a link at the top when I send it out. When the Long-Term Care Planning Committee was established, there was also established a Long-Term Care Advisory Council. And the Long-Term Care Advisory Council currently sits and is chaired by the Commission on Women, Children, Seniors, Equity, and Opportunity. So Michael Werner leads that group, and I see he's with us today. And then it goes on to say who must be in this group. And this group consists of the nursing home industry, the assisted living associations, the Alzheimer's Association, myself, a member of the Long-Term Care Planning Committee, or legislators of the Planning Committee, a non-union home health aide. So there are various groups in here, and individuals with lived experience also tend to attend these meetings. And this is where Michael is very good every year at sending out our call for recommendations and feedback. And we use members of this group to help us put together focus groups where we can go and actually talk to people with lived experience and get their feedback to inform our plan. So what is their exact charge? Their exact charge of the advisory council is to advise and make recommendations to the long-term care planning committee, and to seek recommendations from persons with disabilities or persons receiving long-term services and supports who reflect the socioeconomic diversity of the state. So that is the statutory charge of that group. So we rely on the good work and feedback of the advisory council to inform our plan, and also to hold us accountable as we move forward with implementing the recommendations in the plan to the best of our abilities. So why are we revisiting all of this today? As I said at the top of the meeting, I think that this has been a great group, and it used to be so dynamic because we were actively discussing the recommendations at the back of the plan and trying to work together to move toward rebalancing goals of the plan. We have acknowledged that our plan and the rebalancing goals have largely run their course. We probably peaked, right? So we keep bouncing between 70 and 71% of individuals being served in the community versus an institution. And the group has felt that having that be the sole focus and goal of the plan might not be the best course anymore. And there might be other things that we can look at and do that could continue to move us towards that goal of serving people in the community and eventually hitting that 75%. But that it's time to, instead of just updating the same plan over and over, really look at, take a step back and say, we have a chance here to take the next 2 years to develop a plan that is more narrowly focused, maybe doesn't have 10 pages of recommendations, and say, what are the main goals this group wants to achieve? Where does the state's long-term services and support system need to go? And within the confines of our legislative charge, how do we define that vision, mission, goals of the plan for the next 3 years? And what are the recommendations that we want to include to move us there? Overhauling a plan of this size and really revisiting that mission and vision is a lot of work. And it's not something that, in my opinion, we can do on a quarterly basis. So in taking stock, these are just my thoughts that I am putting out here for the group to discuss today. I'm putting it out there to all of you to provide feedback on a proposed action, right? A what? I would like to propose to this group that we resume work as an active committee that takes measurable steps towards meeting the recommendations in the long-term care plan, achieving interagency coordination. So getting back to not just reporting out at our meetings, but really taking a step back and saying, as we craft the next plan or as we measure our success toward the plan we have now, are there ways we can work together to maximize financial and programmatic resources and solve identified gaps and challenges in the state's long-term system of services and supports? So really becoming a working group of, for the next 2 years, what do we want to tackle in our quarterly meetings? And then how do we do it? If we can't, our quarterly meetings can continue to be report outs, but a lot of work has to happen between the quarters if we're actually going to make progress towards coordinating our services and writing a new plan, right? So how can we do that? First, I should stop here and pause and say, do folks at this point have feelings about the what? The proposed action of stepping back, revisiting our mission, and resuming work as an active committee and really getting focused on moving a couple of things forward and trying to problem solve issues facing our system together so that we can actually have a measurable, achievable outcome in an area. Thoughts on the what before I get into my proposition of the how? Because if we don't agree on the what, then the how doesn't make a whole lot of sense. Barbara.
So I'll go first, Melissa. I just want to applaud your call to action. And I love the concept. And yes, this makes, you have given us a call to action to make everything, or to the extent possible, actionable items that are in the plan. So it becomes a very dynamic group. So I thank you for taking that step. That's all I wanted to say.
Thanks, Barbara. I appreciate that. Anybody else have thoughts on the, yes, Margie.
So I also wanted to say thank you for this, Melissa. And I know that you and OPM do so much work on the long-term care plan, and we've certainly come so far. I totally agree that taking another look at this and taking a more active role in a coordinated role would be so important to move some things forward. I totally agree. I know that it's more work for this committee or any, I see you have subcommittees potentially here. So, I'm up for it. I really think that this will be a great way to move some things forward and really hone in on some more goals. So thanks.
Thank you, Margie. Christine?
Yeah, I certainly agree with the what. I also think, and I don't know if it's a great objective of all that would be, it's just all these discrete work that's done in all these pockets really coming together and defined. Like, instead of us like separately reporting to you and you producing a report on each of what the agencies are doing, if we could somehow synthesize a way that we're all doing it together with how the future looks for us, we're all going to have to kind of pool resources and do the best we can together, and not replicate work and not duplicate effort, right? So I think if we can make sure that that's always present, that coordination across state agencies, and we all are serving this eventually, ultimately wanting to serve the same people, and we're same mission driven work for this group, I think that would be great. I think and I do love when we just take reporting out of statute, and bills are always written for us to study something, report something, but you asking us to do something is really worthwhile. And I wish we did more doing. So I love all of this, Melissa. Thank you.
Great. Thanks, Christine. And Christine, you hit a really good point, because every state agency has some sort of plan that it is required to put together, right? You have, Mike, you have the annual housing plans that you have to do for the feds and for us. And Margie, you have the state plan on aging. And I'm sure DDS has something. In fact, I know you do because I see it, but now I'm forgetting what it's called. And I think DSS reports on absolutely everything all the time. I feel like I am always reading DSS reports. DEMIS, you have reports. So, and then our partners, the Long-Term Care Ombudsman, they do their annual reporting, and they're part of the advisory council. So I think what would be fantastic is if we have this coordinated body, we putting together a long-term care plan that we all put together. And then as we move forward and refresh our various agency state plans or whatever it is that you have to give, and we all have federal confines that we have to do specific things, but what if we coordinate them all? What if the state plan on aging speaks to some of the things that are in the long-term care services and supports plan, so it's moving it forward? Michael, your housing plan has things in it that speak to some of the needs identified. And then we conversely, maybe in coming up with all of that, Krista says, oh my gosh, we have money to do X, Y, or Z. We're looking to do whatever for individuals with intellectual and developmental disabilities. Michael, we can help support that housing initiative. What if we braid our funding to, isn't that great? That's like my utopia, but that's sort of where I would like to see us moving, so that we're moving together in a coordinated manner, which was the intent, I believe, of this plan and this legislation. And also for all of us, the more coordinated we are, not only can we make meaningful change because we're pooling our resources, but every legislative session, when things come up for us to study something, to redo something, to whatever something, we will together be able to say, here's what we're doing. Here's our roadmap. Here's what we've already done. Here's the data we have. Here's the progress we've made. We'll have more tangible things to show to one is looking forward to the new plan, the plan that's going to be due January 1st, 2028, and what that looks like. That work needs to start now because we need to take a year to figure out the format and what you want included, and then a year to develop it. To hold the focus groups, to get the feedback from the advisory council, to figure out what we want this new plan to look like. It absolutely takes OPM an entire year to write that plan. So that means the subcommittee needs got to chop on figuring out what that plan's going to look like. And then, so that's one subcommittee. The next subcommittee would be taking the plan we have now and then future plans, right? When the 2028 plan comes out, but taking the plan we have now and all future plans and have an implementation and progress tracking committee. So annually, and I have not been good about it since COVID. I think I finally pulled my act together this year, but there was a chart that I asked you all to help me update where everyone puts their progress down. Legislation that was passed that got us toward achieving a recommendation, consumers served, etc. But putting together a committee that picks perhaps one or two really important recommendations from that plan, proposes them to our larger body and says, here are the things we would like to focus on, here's why, and then actually I don't mean our daily work is not whole home, but we don't intentionally always revisit the plan and try and do something to move the needle. It's like we know of the issues in our own agencies and we try and fix them. But what if this subcommittee actually comes together and says, you know what? We are hearing constantly that wait lists on the waivers are an issue, or affordable housing that allows families to live in it, multi-generational families to live in it is an issue. The workforce is an issue. Pick something in one of those categories, tackle it and say, this is what we're going to tackle. And that group can actually be responsible for finding the national best practices. What are other states doing in that area? What are things Connecticut is already doing that we could build upon that's successful, not successful? Are there any existing funding that we can use to braid together to fund it? How do other states fund that work? And then come to us on a quarterly basis with updates. Meet on their cadence that they set up, and then come to us with developments. Say, hey, we had this national expert came in and talked to us. Here's the data we found. We had an intern who helped us pull data from, you know, the Massachusetts, Oregon, and Washington, which are states with best practices in self-direction, and they found that they're doing this, whatever it is the topic they pick, and then actually track progress towards meaningful things. And then in our quarterly meetings, be able to give that group feedback or say, ooh, we just got a grant that does X, Y, or Z, or I'm writing a grant for whatever, or I have this pot of funding. And that's how I see us being able to actually work together to coordinate and move the needle forward towards progress. That's the vision of the subcommittees, and I'll circle back to get everyone's thoughts on that. But if I was all of you, I'd be sitting there going, oh crap, I can't do this quarterly and then be on subcommittees. The good news about a subcommittee is this group is statutorily mandated, right? It is who it is. Subcommittees, we can nominate the people and bring in the appropriate people to form these subcommittees. So in other words, in my office, maybe it's not me who can do the long-term care plan development subcommittee, but I know that I have a colleague who's very interested in this and has the bandwidth to take it on. So that's the person I nominate to be on the plan subcommittee, development subcommittee. So just, I think that if folks are open to it, that's how I would say, if you're dying to be on one of these subcommittees, you're also smart and well-versed, I would love it. But if you don't have the capacity and know of staff people or someone in the community who you think could be on one of these subcommittees, great. The plan development subcommittee, and sorry, go ahead, Christine, you want to jump in?
Just a quick question. If we are thinking about designees for some of the state agencies and such, would you be open to more than one? I know subcommittees can get unruly in size, but you know, a lot of our programs are very big and diverse, and it might be hard to identify just one person that can bring all aspects to some of these subcommittees. Would you be open to more than one rep on the committee?
Well, so I think that you raise a point down in next steps about the who, is we would just need to decide what is a reasonable number.
Amount, okay.
Because if you get more than 10 people on a subcommittee, nothing's going to get done. So, you know, we can discuss what we think about for size, and it might be, Christine, that people get swapped, that we bring in people to speak on something. Maybe you have one staff person who's on the subcommittee, but when we start, if you're like, oh my gosh, we're doing a lot of talking about the autism waiver, then you go and you bring in the person who needs to speak to that.
Sure.
For that.
Thanks.
Can be the subject matter expert. So in thinking about the who, I also started to think about, and this I will admit stems from my own personal frustration on being on 90 million committees that have the same charge and the same participants. So looking at, can we, particularly for that long-term care plan implementation and progress tracking subcommittee, can we tap members from other committees that exist and have a similar charge? The Long-Term Care Advisory Council, I think, would be critical to have, you know, representation from that group on these subcommittees. Members from the Long-Term Services and Supports Rebalancing Committee. Recently, they've been talking a lot about their mission and vision and how to move forward. And that group is a group of very much overlaps with the group that's supposed to be on the Long-Term Care Advisory Council, right? And we use that group to inform our plan. Every year, DSS sends out for us invites for feedback, and we get feedback from those members on our long-term care plan. And we also get critique from that group sometimes on whether or not we as state agencies have done enough to make progress toward the recommendations in that plan. So let's bring them on board and have them help us to not only set the goals, but then meet the goals that are out in the plan. Put all their lived experience and good knowledge to work. And then if there's any other, group or something person that we think should be on the group. And then I left it with total number TBD, because I do think that that's something that we need to set, and then we can go forth and start to put something together. Huge ask. So what's my goal for all of this? I would like to open it up to discussion now from all of you about the concept of subcommittees. If you like this path forward, think about how it would work, and if it would be possible if we decide to move forward with the subcommittees, does it seem like it would be possible to get them established by the end of the summer so that we can use our September meeting to really figure out, have the subcommittee members introduce, attend, meet all of us, and launch into moving forward. So I have done a lot of talking and thrown a lot at you, but very much would like to hear what folks think about the subcommittee idea for moving us forward, and what folks think about being able to, the number of people that should be on each subcommittee, if you agree with the subcommittees, and the number that should be on it. And then I think we would use our September meeting, or maybe even allow the subcommittees to kind of come up with, to set the subcommittees off with their vision and their mission and their goals, and then have them meet separately, because every committee has their own culture and their own way they're going to want to operate, but at least give them some guidelines for what their charge is, so that they can go off and start doing their work after our September meeting. Do you all resign? Are you still with me? Where? Okay, how about this? Someone, all right, Margie, thank you. Yay or nay to the subcommittees?
Yay to the subcommittee. So, I mean, going back to what I said before, I am very supportive of looking at this differently and trying to find a way that would be as most meaningful as possible. So I agree with trying this differently. I think with subcommittees, we can do more. So I agree with that. I'm looking at the two that you have, and they have different approaches. And I think that one thing that's so important with both of these, and re-looking at this, is the coordination piece. I mean, we do our thing and then we report to you what we did, but, and then we do updates, but I don't feel like it's all coming together as intentionally as we would like it to. I know we've talked a lot about coordination when we talk about the multi-sector plan, the no wrong door, things like that. These types of groups with really meaningful work and the coordination, I really think can move some things forward. I think it'll be challenging, perhaps, depending on who's in the group, to try to narrow it down and to get to certain goals that we want to all accomplish. But I do think if we actively collaborate cross-agency and to have enough representation cross-agency, and that's the type of thing that would make this work better. I really like your idea for the implementation and progress tracking, if the groups are willing, the advisory council and even the rebalancing committee. It sounds, it's probably a big lift, but to get some real action from stakeholders, to have people with lived experience talking about what are a couple of key action items that they can try to help solve. I love these ideas. I think it has a lot of potential. So we're happy to have staffing of whichever committee you think we belong on. I do think having the most cross-agency representation would be great for really to move different things forward. I don't know about numbers. I know they can get a little unruly, but I guess we could certainly talk about that. So I'm in favor of this, as you can tell, and I'm happy to either participate or have staff participate. So thank you for these ideas. I really like it.
Great, thank you. Anybody else? And then I actually think what I am going to do, because this is a change, so I want to keep the discussion going, make sure everyone gets a chance to talk, because if we do decide to go the route of forming subcommittees, I am going to call for a formal vote on that to establish them, because it would be a change in our operation. So I want to make sure that we have a record of that. So with that, I will go, it looks like it goes Christine and then Krista.
Yeah, I'll be super quick. Just to echo what Margie said, I think if the long-term plan development subcommittee, I think we could still set broad and like auspicious goals for us, right? And things that all state agencies should be working to, and Connecticut as a state. And then that implementation and progress tracking subcommittee needs to focus on targeted interventions and not every goal, right? So don't just, as long as it's like we do this plan, we pull down our top 2 priorities to dig in, we track everything and hold everyone accountable for all of it, but the implementation crew is really hyper-focused. Like, I just think so we don't lose sight of that, like, it doesn't become too chaotic. Because then I also love the accountability to all of us, right? Still do your mission and work. We're going to bring in, like Margie said, the lived experiences, the experts, the SMEs in the departments for the targeted work, and then track everything. I think it's an interesting balance. I am curious how we would execute it, because depending on what we're focusing on is probably who needs to be in that subcommittee. So there's a lot of work and a lot of negotiation and planning to figure that out. But I think it really could be something meaningful and really like a really way to measure success with this like in-depth dive. So that's all I wanted to say.
Great. And to that end, one thing we could think about doing, well, no, I'm going to take it back, because I do want the subcommittees to be able to pick the things they're passionate about as well. But go ahead, Krista.
Thanks, Melissa. So my comments actually tie nicely with what Christine just articulated. It was to talk through the subcommittees a little bit. So my suggestion is really about the focus of the subcommittees. I think usually when we look at subcommittees, their charges are clear in the beginning, but then very quickly it becomes lost in sort of all of the other responsibilities of the larger committee. So I think really focusing on targeting those subcommittees, focusing on their goals is going to be really important, setting agendas in advance, making sure that there is tracking towards completion, holding the subcommittee members accountable for action items after every meeting. Those are the things that are going to really make this structure successful. I think overall, Melissa, absolutely on board with sort of the revised view of this committee. I think it's necessary, and if we are able to make it successful, will really help shape the future of long-term care. The other piece I just wanted to mention very briefly was the timeline. So the slide that you had up talked through a proposed timeline of maybe confirming the subcommittee group, I think, in the summer, and then getting things started for September. That is a pretty ambitious timeline. I hope we can make it, but wanted to just mention that maybe adding some flexibility in there might be helpful as well, understanding that we are pretty much in the summer, although it doesn't feel like it. We're already in the summer, so that timeline looked a little bit ambitious. So maybe a little flexibility there might be helpful, but I think overall it's a really good approach. Focusing in on the goals of the subcommittee is going to be really important, and then holding people accountable to action steps and agencies to action steps, I think will make sure that it's successful.
You know, to that point, I think you and Christine and Margie, you know, you've raised really, really good points. What if folks, once we vote, if everyone's on board with the subcommittee idea, what if instead of trying to get everything put together in the summer, after this meeting, I go back and watch this meeting again as I'm doing our minutes and all that, but actually write up, based on all of your feedback, a more clear mission statement and purpose statement for each of the subcommittees, and then circulate it to you all over the in the coming weeks for feedback, so that you can take time, gather feedback. This group can decide which of the, here's what I don't want to do, and which is hard with the implementation and progress tracking subcommittee, is I want to make sure that when we bring people on board that subcommittee, who, particularly those with lived experience and advocates, and I'm thinking of a lot of the feedback I heard from the long-term services and support steering committee, that, they want their voices heard more. So folks like that, trying to bring them on board, I want them to be able to tell us which of our recommendations, have a say in which of our recommendations or tasks in our current plan really need to be addressed, and say to us, okay, we feel that blank is the thing our subcommittee needs to focus on. And that will then therefore drive probably who needs to be appointed from each of our state agencies to the committee. So maybe it comes with getting the lived experience and the advocates and everyone on board first, and having us, our membership, be at that first subcommittee meeting. And then once we figure out, okay, they want to focus on, I keep using housing. Housing's very much on my brain right now. They want to focus on housing.
I think it's on theirs as well.
Yeah, absolutely.
So they want to focus on housing. Okay, then we keep saying, what part of housing and what part of that? And how are you going to fix that? And drill down till we have something concrete that they can be working on. And then we'll know who we need to put in from the state agencies. But I can take the summer, we can take the summer for me to come up with trying to better define those subcommittees, circulate it all for you to provide feedback until there's a defined purpose for each subcommittee that the whole of us, our long-term care planning committee, agrees on. And then we can, if we can at least decide that we know we want lived experience and the advisory council and the long-term services and supports committee members, etc., then we can at least leave this meeting and start to have a conversation. Poor Michael's sitting here going, wow, my committee's being talked about a lot. So I can actually,
fine.
Call him and talk about it more, talk about, talk to the long-term services and supports committee members, other committees that we're on, and see who might want to, what they think and who might want to serve on it. So I'm just wondering if that makes sense to people, instead of saying, let's just start appointing people and doing work. Let's take September, the summer to plan it out, September to talk it out, and then leave our September meeting ready to form the groups.
So Melissa, I don't know if it's Erin, if you can see my hand.
No, I'm sorry, Erin, go ahead.
That's okay. So I just wanted to piggyback. So I'm on a commission in my town, and we have an implementation group that meets quarterly. And so what we did was we did our plan of conservation and development. And one of the things that we said was, well, we need to hold people's feet to the fire. So we meet quarterly, and there's a document that has like short-term, medium, long-term action steps. And what we do is we're monitoring that, and we give ourselves a pat on the back when we accomplish something, and that goes in a certain color.
Yeah.
So I think if you did a committee, you know, that might be something to look into, to have kind of a document to help guide people or something like that, that has it broken down. Because you want to get some low hanging fruit while you're working on more long-term plans,
Yeah.
right? You want to have and so what have we done? Or if it's a longer term goal, why haven't we done it? What do we need to do? So it's just a suggestion, but I have to tell you, it's really helped us immensely in getting things checked off the POCD, and really hearing from the other land use boards rather than just having this document. It's a living, breathing document. So you probably could do something like that from your plan. That might help.
I think
guide
we
the work.
definitely could, because we already have the annual report with all the
Right.
recommendations in it. But all we do at the end of the year is say, did we do it or not?
Right.
We don't.
So if you
So
put it-
making it
yeah.
a living, breathing document where it's red, yellow, or green, or whatever we
Exactly.
decide to do, and what needs to move, a dashboard is a really great idea. But that
And then
brings me
complete it.
to,
You could actually put in that plan things that are completed, things that are ongoing, things, you know, targeted. So yeah.
and
Anyway.
what are the barriers?
What are
Identifying
the barriers?
why.
Yeah.
The
So
other
just a thought.
thing,
And it would help that
that's
committee.
yeah, that's a great thought, but it makes me wonder then if long-term implementation and progress tracking for right now are two different things. Is it implementation where they're picking something to move us forward, or is it progress tracking, or is it really all one thing?
We
and
do
what we're
all
doing,
one thing. We call it implementation and tracking. So, you know,
okay.
the plan has been live for almost a year and a half, right? But we call it both, but we're tracking, you know, for the next 10 years of that document, unless we decide to update it sooner. So we call it
So,
both. It's really
yeah,
tracking, but yeah.
So I was envisioning a group that was a roll up the sleeve, pick one topic that's hard to tackle, and like do the research, do the deep dive, and come to the group with recommendations for how we can actually solve the problem and move the state forward, which is different than just like tracking how we're doing on the current plan. But the other thing we could do is start with just doing that living, breathing document. That's the dashboard. Have that committee just track what we're doing now, do the red, yellow, green, or however we decide to do it, identify the barriers, the gaps, the what needs to happen. And then from there, we have a data set that says, here's one we think we can actually tackle.
Exactly.
So that might be the better way to
Because then you
think
feel like it
about
informs you. It's coming from the
Yeah.
plan. You can see it in writing, and that's,
I like
you
that.
know.
Do others feel good about that approach? I like that approach. We're also going to have to, and we can discuss this in September, but obviously every subcommittee needs a chair. And, you know, I'm trying to think that, you know, we probably should have at least one of us on each subcommittee. I don't know. I haven't thought about it yet, but there's got to be something that keeps these groups on track, so that we're going to have to tackle all of that. And I'll try to put it in the document I create for food for thought when I'm doing the purpose and the logistics. And maybe I'll even come up with a template, Erin, because I think I have something from another project we did here that we could use for this, that purpose as well.
I can probably get you an electronic copy of what I can try to do that. If that's helpful.
I'll look at anything.
Okay, but let me see what if I can
too. So
scrounge something up. I think I only have hard copies. It's probably not going to be that helpful, but.
Well, even if you just send me a picture of what one of it looks like or something, I could recreate it. It's just trying to gather ideas. And I think there are project tracking templates and things.
I think that's what this is. Yeah.
Great. All right. Any other discussion? So I'm going to call for a vote on the subcommittees, knowing that should we vote yes, then somehow I'm leaving with homework when the point of this was not to have as much homework, but that's okay. I love you all. I'm happy to do it. So I'm going to come up with, try to give us a starting point. I'm going to take my best shot. Please know it's just Melissa's thoughts on subcommittees and purpose, and that you all should weigh in, and this should be the group's subcommittees. And try and flesh it out a little bit more in hard copy so we have things to react to. I'll make it a share doc so we can be doing it over the summer so that we can hit the ground running in September to talk about where we landed, how we see the groups operating, and next steps to getting them established and up and running. Sound like a plan? Okay. So is there any more discussion before I call a vote? Let me just count heads here. I think Michael had to talk to the commissioner. Laura, are you on from housing still?
Yes, I am.
Oh, would you be able to vote?
Yep, I can
Thank
do
you.
that. Yes.
Okay. All right. So, would someone please make a motion to move forward with the creation of the Long-Term Care Development Subcommittee and Long-Term Care Plan Implementation and Progress Tracking Subcommittee?
So can I
So
just say
moved.
so moved?
So,
Yes, you can.
So
I
moved,
will.
right, Barbara, you and I had the same thought. Okay, so Barbara, if you moved, I'll second.
Okay.
so moved, Barbara
I
Cass.
second.
Thank you. Barbara second. Oh no, Aaron second, Barbara first. All in favor?
Aye.
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 Any opposed? Any abstentions? Okay, you just created two subcommittees of the Long-Term Care Planning Committee. So, so the next steps are on me. I will codify those steps in the minutes, and if I will also, so that I don't forget, just send a quick email out, and we will go from there. Thanks everybody for the great discussion. Is there anything else on this topic before we move on? All right, thanks everyone. Are there any member updates and announcements? Margie.
Okay, super quick. So the Bureau of Aging had applied for 2 competitive grants recently. One was the No Wrong Door Infrastructure Grant. So I did want to say that unfortunately we didn't get that one, but we're coming up with some ideas to kind of move our No Wrong Door system forward anyway. We think we have a lot of partnerships started. So we're excited to keep moving forward with that. The other grant we applied for was a fall prevention grant through the National Council on Aging. And that was to support the development and enhancement of our new Falls Coalition. So we did receive this grant. It's a partnership between the Bureau of Aging and the Department of Public Health. And it will really enhance the work that we're doing on the new Falls Free CT Coalition. So thanks for letting me do a quick update.
Thanks, Margie. And you guys did so much work on that, and hopefully we can be of assistance in perhaps moving some of the components of that overall grant proposal forward. There's probably some good things in there that if we all pull together, we can still move some of it forward. So look forward to continuing the conversation. Anybody else? Update or announcement before we move on? Okay. Michael, is there any update from the Long-Term Care Advisory Council? Other than you got to sit through us talking about you behind your back the whole time.
I was in my presence, so that's okay. I was here. First of all, thank you, Melissa, for a very robust meeting today. Thank you for your leadership and moving forward. You know, we noticed the legislature this year taking interest in our work, and we're grateful to move together collaboratively with you to help respond to their needs and to continue forward in the work that we have been doing. So thank you for that. Also, thank you to Heather for her legislative report out. As usual, she did a very excellent job. The next meeting of the Long-Term Care Advisory Council will be on Wednesday, the 25th of June at 1 p.m. So I will be sending the invite out to our membership shortly. And other than that, thank you very much for having us here today. Thank you.
Michael. And thank you for to you and the advisory council for being such good and strong partners. We couldn't do our work without all of you. So thanks so much.
Our pleasure.
Okay. Is there any other business? Christine.
I just wanted to share, and Michael, I don't know if anyone reached out to you yet, or Melissa. The CMS issued a final rule that's going to take effect this summer that requires DSS to establish a Medicaid Advisory Council and Beneficiary Advisory Council. And I was questioned on similar groups or things that might already exist for opportunities to find participants and recruitment. And I thought, Michael, your team might be a good recruitment source. So I provided your name. I'm sorry I didn't tell you in advance. I'm just telling you now publicly. But I really think it's a great thing. And it's going to be led through a different division in DSS. It's not in me. So it'll be great to kind of get different people engaged across the beneficiary space. But I thought you guys might be on the pulse of people that might want to participate, and they might ask to be on one of your next agendas. So just wanted to put that out there that DSS is working on establishing a beneficiary advisory council.
Thank you for that update and for thinking of us. Happy, of course, to collaborate and meet further, Christine, offline, if that's at all helpful. And
Sure,
certainly there's time to add folks to the agenda before the 25th. Thank you.
Okay. So that was our last item of business. Any other comments? If not, our next meeting is Tuesday, September 9th. We'll hopefully do some refinement of our subcommittees while we're in between our summer vacations that I hope all of you are taking some time off. Very well deserved. It's a hardworking group. And with that, I will wish you all a good summer and entertain a motion to adjourn. This group never wants to end the call.
I motion to adjourn. I never
Thank
get named
you.
in anything. Christine motions to adjourn.
Okay. Second?
I'll
Second,
second.
Melissa.
Okay. I think Krista beat you by a hair.
Yeah.
So Krista second, adjourn, all in favor?
Aye.
All right. Thanks, everybody. The meeting's adjourned. Have a wonderful summer. See you in September.
Thank you, Melissa.